Well, welcome everyone to NAMI at noon. My name is Amy Brundle. I'm the Director of Marketing and Communications here at NAMI North Carolina. And as always, we are super excited to have everybody here for today's webinar. We'd love to thank the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services for their support of today's webinar. And if you've joined us before, you know this spiel. But otherwise, if you've got any questions for today's speakers, please put them in the Q&A section or the chat below, and we will answer them towards the end of the presentation. We will also be sending out any materials the speaker provides, including the recording and a feedback survey later on this week. And now, I'd like to welcome today's speakers who come to us thanks to our collaboration with the Collaborative Health Network. First, Terry Herman serves as the Senior Vice President of Strategy and Development for Spark Services and Programs. In this role, Terry's responsible for the company's program and business development strategy, as well as policy and political strategy. She's been working in the behavioral health field since the late 90s and has worked with children, families, and adults in residential and community-based settings. Terry holds a Bachelor of Science in Psychology from Le Moyne College in Syracuse and a Master's in Forensic Psychology from Sage Graduate School in Albany, New York. Shantiza Queen is a certified peer support specialist who's also in long-term recovery, and she has dedicated her career to supporting others that may be experiencing some of the same challenges that she has faced. And Nikki Starling is a family peer support specialist who works alongside families to promote strength, resilience, and self-advocacy. And this webinar in particular is co-branded with Collaborative Health Network, who's been very gracious to lend us some of their expertise. Spark Services is a trusted partner within that network, which is a statewide clinically integrated network dedicated to advancing whole person care. At Collaborative Health Network, peer support is a critical component of whole person care, and CHN actively works to elevate and integrate peer support across their provider network because they believe individuals with lived experience bring insight, connection, and hope that cannot be replicated through traditional care models alone. CHN is proud to help advance the role of peer support across the network, and they're excited to see this group of speakers continue to expand awareness and understanding of its value. So they encourage providers and partners to join the conversation and learn more about how peer support can strengthen care delivery and improve outcomes. And after all of that, welcome to our panelists this morning.
Thank you so much for having us. We're very honored to be here and to talk about peer support.
Yeah, we're excited to have you guys and excited to have a variety of different experiences to discuss today on this really important topic. So, again, thank you all so much for joining us. We appreciate it. So I want to get started by really we understand that we've got a peer support specialist and a family support specialist on the call today. And I want to start out with us understanding those terms. So, how would you all describe peer support and family support specialists?
So I can give a kind of how I view those, and then I would love to be able to get this straight from Shantiza and Nikki because they certainly are the stars of today's discussion. You know, when I think of peer support, that is somebody with that lived experience, and that is in their own recovery journey, and that can be, somebody that has experienced some mental health challenges, some substance use disorder, just some things that are going on in their life, and they are in that recovery journey and have had made that decision to take the things that have worked for them and extend those strategies and supports and empathy and encouragement and hope to others. And that family peer support is really that same thing on that family side. It's that parent, that adult caregiver who has raised a child and has had involvement in our mental health system, our substance use system, maybe in our IDD treatment services, in interactions with our child welfare system and our juvenile justice system. So they have had some really challenging times as a parent. And again, they have taken those things that they've experienced and they are extending those things that have worked for them in their journey to other parents who are struggling. And I think the core of both of those things is not only the hope that these individuals bring, but that sense of you're not alone, you're not the only person. So,
Mm.
Shantiza, I know I only scratched the surface. What would you add to that?
Thank you, Terry. You did such a good job of explaining that. Yeah, so peer support is someone that has lived experience, and whether it's in mental health, substance use, housing insecurities, domestic violence, interpersonal conflicts, like you name it, a peer support is someone that has experienced those things and then come out on the other side of that. And so they take their experience through those and how they found recovery or found a path to create their own future. And they take that and they come alongside other people that may still be struggling in those areas and walk with them and help them to create their own path to recovery.
Nikki, what are you adding from that family piece?
Well, just to piggyback off of what Shantiza said, lived experience. That's who we are. So just a little bit about myself. I have experienced. I have a how can I say this? Um, they like to call him my target child, right? And this is how I ended up here. And I was that family member, searching for resources and looking for help and knocking down every door and sometimes feeling alone through the process. So when the presentation, when it was presented to me to be able to walk alongside someone who's experiencing things that I've been through, it was like second nature for me. It was easy for me to be able to come in and support that family because I've been there and I know how that feels. And it can be lonely, but it always feels good to know someone's with you through those processes.
Yeah, absolutely. So, this is an important role that not everybody can play, especially in an agency setting. So, as an agency, Terry, why did Spark make the decision to incorporate these specialists into your care models?
Yeah, I mean, I think the title of our presentation today, "The Power of Peer Support," is really at the crux of that. Y- Peer support and having that person who has literally walked in the shoes of those that we serve and support is so critical. And we know that everybody's journey looks a little bit different, and our goal is to really be person-centered, family-centered, and really give the individuals and families that we are working with every tool and resource that they need to meet their own goals and objectives. And a huge part of that is being able to have somebody that can, like to use Shantice's word, walk alongside them and to hold that hope. And I think it brings a different level of I can do this, right? When somebody that you're working with has that peer support and they're like, oh, recovery is possible, hope is possible, getting to that other side, whatever that looks like, is possible versus somebody that is the therapist or the doctor or the nurse, and you're like, but do you really know? And we
Exactly.
need really all of those team members working together to support those that we are so fortunate to be in that position to serve. And I think it's critical too to hold us as an agency accountable, right? Because if we go, we're going to implement this grand idea that we have come up with, it's important for somebody to go, that looks great on paper, but that's not going to work in the real world, right? So I think as an agency, when we think about how can we give the very best to those that we have the opportunity to support, it's we're giving them all of the tools from that staff perspective and that combination of team members, but it's also internally as we're setting up services and programs and policy to have individuals with those lived experiences to hold us accountable to be like, yeah, that looks great on paper, but that is not going to fly in the real world. And it allows us to be better, right? It just
Mhm.
allows us to be better.
Yeah, absolutely. So, can Chanchiza and Nikki share a little bit with us about kind of maybe how you got into this and why you decided that this particular career choice was the correct one for you?
I guess I can start. Um,
Hmm.
actually, it didn't choose me. I didn't choose this profession. It chose me.
Hmm.
I was a lived experience. I was already living the life and walking the walk, right? And had been through it was I remember going through like every door, through the church, through the court, through the school, through the, community centers, and I went through every door, looking for the support that I needed for my son. And I went to the place that I got started at, and I was actually looking for help. And they were like, you are family support. And I
Mm,
did not understand where they were coming from at the time. They said you've been walking the walk, and you are that person. And so as of course I took the job. Like I said, I think the job chose me. And once I took
hmm
the job, it turned into more of a career path. So I've been active for 13 years now.
Wow.
And yeah, so yeah.
So my story is a little bit different. I spent about 28 years in active addiction and everything that comes with that, right? And about, I would say maybe 2 years into my recovery journey, I was still going through it with my kids. Like I had created a lot of damage with them. And so one of the things that I was having to do was this class called Nurturing Adolescence with my son. And so in that class, they would have guest speakers come in and kind of share different aspects of, various things. And one of those people that came in was a peer support specialist. And so when he shared his story, and like where his path was and his recovery journey and what he did now as a peer support, it planted a seed in my head and it got me thinking all of those experiences, good, bad, indifferent, that I had been through, I can take that and help other people. And so it planted that seed. And after talking to someone that was really close to me, my mentor, she was like, you should take the class. Like, just do the training, do what you need to do. I had a really great supervisor at the time. I worked in furniture, and he allowed me that week to go take the training. But I sat on it for another 3 months. And she's like, just submit the paperwork, just see what happens. And I did. And I'm so grateful that I did that because this has been one of the most rewarding career paths I've ever had in my life. And I've worked a lot of different jobs. And being able to sit with someone and say, I know exactly what you're feeling, or hey, I've been through that too, and this is how I got through it. So maybe I can offer some hope, right? Or some experience. So that's what got me into peer support. And I'm so grateful that I had the people in my life to say, just do it. Just
Mm.
send the stuff in because you never know what's going to happen.
Absolutely. It just takes that one step, right? So we titled our webinar "Power of Lived Experience," and have already started talking about the power of peer support. But what does that phrase, the power of peer support, actually mean to you all?
I think part of what, when I think about the power of peer support, it's that knowing that I'm not alone, knowing that somebody else's story has some similarities to mine. It is thinking about having somebody that I don't have to worry about being judged. I don't have
Mm,
to worry about maybe feeling like I'm going to be less than or feeling like they're not going to get it because they have no idea. So I think about it's creating that connection. It's creating that sense of belonging, creating that sense of hope. And when I think about we do this in a lot of different settings, we don't always call it peer support, right? But we go and we have our maybe our group at our faith-based organization, or we have um a group for veterans, or we have a group that right? Like, or you have your soccer club or you have whatever. And it's creating that network of people that speak that same language, that speak, that it make you feel at home. And so I think when we just take those things that we kind of do in our everyday life and we bring that into our behavioral health space and we bring that into recovery and into treatment and into ways that we can support one another, I think it's, to me, it's unstoppable. I have seen individuals who have our peer support or our family support titles run circles around individuals with who've spent years and years and years in formal education and have all the letters behind their name. But because of that lived experience, because of those shared experiences, they're able to tap into that support for that person in such a novel way and be that catalyst for that person to create the next chapter in their story. So that's personally kind of where I think of this.
Hmm.
Yeah, for me, when I hear the power of peer support, I think of creating space for the other person for true relatability. Like, I'm not a doctor, I'm not a therapist, I'm not a nurse, I'm not a social worker, like, I'm not these other titles. I'm just a peer who I can sit with someone and get on their level and help them feel comfortable in that space. And so, whenever I create this space for them, the walls start coming down and they can start truly sharing who they are and be authentic in whatever, right? Like their emotions, their thoughts, what they're really struggling with. And it's not that I'm there to fix them, I'm just there to provide this space to where I can say, hey, I get that. How are we going to work through it? And help them come up with different ways to manage some of those emotions or process those thoughts in healthy ways and be able to get on the other side of it instead of staying stuck in it.
Shantiza couldn't have said it no better way. Well, a part of my spiel is I'm no nurse, I'm no doctor, right, Terry? So I say that a lot, and I'm no nurse or no doctor, just regular person who's had the lived experience. Um, Providing that like non-judgmental, safe space, do for, cheer on, just living with that, by that as is like what we do. I think it's just we're non-judgmental, non-biased. We've been there, so we are very relatable, and that gets a lot of doors, like a lot of walls coming down, like she said, for say, um, yeah, I think
Yeah.
family, yeah.
Well, and you guys have touched on this. I'm not a nurse, I'm not a doctor, and that's a great clarification to make. But can you expound a little bit on how you see the role of peer support and family support specialists as being different than the other providers that somebody may come across in their recovery journeys?
I'll go, I guess. Yeah, like, not to say that a peer support is not a professional, because we are professionals,
Mhm.
but we don't hold the same level that a psychiatrist would, for example. I have a lot of respect for psychiatrists and doctors and therapists and nurses. Those roles are absolutely needed in this field. I think that we wouldn't be where we are without them. I think peer support is more like a bridge. Like, we help to bridge the gap between the client and the professional, whether it's helping them to learn how to advocate for themselves or learn how to um, identify what their needs are and work with the other professionals in a more respectful um, and just in a better way because we're there. And I feel like peer support helps to empower the client to be able to create that positive relationship with their other providers.
So, I also want to understand kind of when we use the word peer support. Obviously, peer is kind of the word that we in the mental health space are using for somebody with lived experience, somebody who's already gone through this journey and is maybe still in some kind of active recovery, but could also be in different stages of that active recovery. So I want to understand a little bit more about the difference between somebody who's got lived experience and somebody who is a formal peer support specialist or family support specialist.
Well, I wouldn't say that. Well, there is a difference, but they're two in the same, right?
Mhm.
So I'm a family support partner through Spark. I've been a family support partner in my other position for 10 years. But the reason why I'm a family support partner is because of my lived experiences, right? So which makes
Mhm.
me a peer support. So they go hand in hand. So the difference is pretty cliche. Like it's not really too much of a difference, but we and I can't really speak for everybody, but I know that I've had experiences with family support that I haven't had with, peer support. Peer support, not to minimize um, the peer support, of course, because that is very, very essential. But for family support, I've had to help support families in different parts, different aspects. So I have a child who suffers from mental health, but I've supported families who went through drug and alcohol. I've supported families who've went through different child support court, maybe family court, juvenile court, adult court, different types of, systems with the family support opposed to the peer support. So we're pretty open, pretty broad with family support. Peer support is kind of like one on one. If I'm dealing with someone who has a child that has mental health like me, that's my peer. However, I don't juvenile or adult court. I'm still supporting as a family support partner.
Right.
Just
Yeah, I would say there are a lot of similarities. I would say the one thing that separates someone from lived experience versus a formal role of peer support is the intentionality that's behind it. So you and I can sit in a room and we can talk about all the things that we have in common, right? Good, bad, or indifferent. But what a peer support does is they step in with intention to say, okay, we've identified these things. How are we going to get on the other side of it? Like, what is the solution? Let me help you or, support you with creating a solution because we can sit and talk about our problems, right? But if we're not getting on the other side of it, then we're just venting. And I think that just the for a peer support, they are very intentional in the work that they're doing because they have developed these relationships with their clients. They know the ins and outs of what is going on in their life and know that, okay, this person is stressed, but they're also struggling to pay their power bill. And so it's the intention behind let's figure out ways to budget your money or get you connected to resources to pay the power bill so that your stress comes down and then we can work on other things, right? So I think for me that's what separates or what makes it a little different is that intentionality behind it.
Yeah. So, I want to ask this, and I don't, this might be out of left field just a tiny bit, but I want to ask about like the training and process involved in becoming a peer support specialist. So you're a person with lived experience, either as a peer or as a family member of somebody with mental health conditions, and you are like, I want to turn this into a career or a way to help other people. How do you get started? Like, what is the process to actually becoming a peer support specialist or family support who's doing this on a regular basis?
Shantiza, do you want to start with the peer support process? Because there is two different certification and training tracks, whether you're doing peer support or the family support. So we'll have Shantiza talk a little bit about that peer support track and then turn that over to Nikki to talk about the family support track.
Yes, absolutely. So they recently changed some of the requirements for the peer support certification. You have to be someone with 18 months of recovery. Um, there is a 40-hour training that you have to do, which you would go to a place Monday through Friday, usually 8 to 5. They take some breaks in between, but it is a training specifically designed for peer supports. You can find those trainings on the North Carolina Peer Support website through the UNC Behavioral Health Springboard. Those trainings are there. Then you have to do an additional 20 hours of training. Once all of your trainings are done, 60 hours total, you can fill out the application online through the North Carolina Peer Support Specialist website. They are very good at laying out all of the steps that you have to take, very responsive and giving you feedback if you have questions. Once you have all of that submitted, it takes a couple weeks, and then they'll send you your certification in the mail, and that's it. So every 2 years, you have to maintain your CEU. So you need 20 additional trainings. 3 of those, which this is my favorite part, 3 of those have to be ethical trainings. I'm so glad that they started incorporating that in there because it keeps it fresh, because we want to make sure that we are following ethical standards and guidelines to keep our people safe. So that's it. Yeah, it's a simple process. It sounds like a lot, but it really is a simple process.
And the one thing I'll add to that is, to work for most agencies that are going to be billing Medicaid as a peer support specialist, you do need to have completed that training and certification that Shantiza just talked about prior to starting um, in those roles. Now, some agencies may hire you and then go through that training and then bring you on, but prior to delivering those services to individuals under North Carolina Medicaid, you do need to have completed that training and certification process.
So for me, it was a little different because I started in another state. So there was a credentialing process that you had to go through to get there. Like I said, I walked in looking for help, and I left with a with a job, and they trained me, throughout the throughout the time. When I got here to North Carolina, I was adamant I was not coming back to this field. I was adamant, but God seemed different. And I kept getting an email from Spark. So then I met Terry and Layla, and it was like, this is my calling. So the trainings that I get here now, same, sort of like credentialing, it's 100 hours. It's 100 hours to get fully certified. But, wherever you are in the process, it's like you can take your time. It's not like 100 hours and a month. You can kind of, take your time to get through all of these different classes. And there's so many different ones. I can't even name them off the top of the head, but it's a rewarding, it's rewarding to complete because I think like I do this work from my heart. I would do it for free, so if you're interested in coming on board, we need more. North Carolina really, really needs more family support partners. I see it every day.
Yeah.
And what I'll add there is, on that family support side, that is done through UNCG, and they have a family support training track that Nikki said is very intensive. With our current contracts and things, our family support partners do have 18 months to complete that, so they are able to work with families and deliver care and services and supports while they are going through that training and certification track. And at the completion of that, that is a national family support partner certification program that they have. So again,
Mm.
each of those are just a little bit different in terms of how they operate, but the core is really helping these individuals as they're going through that training process to say, how do we take that lived experience and then with intention, I love that word that Shantiza used, with intention, go out and bring that into the world to support others in their journey.
Yeah, absolutely. Thank you for sharing that information. Um, I will try to include those links for the different programs in the information that I send later on in the week, just in case anybody on the call is interested in following up and potentially, making this their calling as well. Um, So we talked a little bit about the fact that you guys are differentiated from other types of providers. And I want to know if there's an experience where another professional, a nurse, doctor, therapist, we're not naming names, but I just want to know the story. If they downplayed your role or threw up a roadblock for you being able to kind of perform your role, how did you advocate for the services that you provide that are so crucial?
This happens more often than less, to be honest. Um, this happens quite a bit. I think that there's some judgment and bias when it comes to family support partners, and they'll just say sometimes they're just a peer support or they're just a family support partner. However, the families identify us as the worker, right? So, and when they look at all of us, we're all the worker, and we are all the social worker, or we're all the counselor. That's how the families identify us. So they wouldn't. Sometimes a lot of the families don't know who from who. What they do remember and realize, and work with is the people who show up, right? And we're the people that show up. We're the people that show up, and we meet them where they are. And I've been on the floor with them, and I've been homeless with them, through that part of their journey. And that makes a big difference. So I've had professionals, come and try to downplay my role. And I've had parents that stood up in front and said, hey, if it weren't for her, we wouldn't be getting anywhere. And I was doing this before we had this family support partner in play, but nothing was getting done. So let's not, downplay her role. And so it's just like it's rewarding. It makes you, it's like, keep fighting with the families because you're doing something right. Yeah.
So I personally have not had any experiences in my role necessarily being downplayed. I think it was more about not fully understanding what the role was. And so I had some experience working on an ACT team, which is assertive community treatment team. We like to describe that as the hospital without the walls. And that's because there's a psychiatrist, a nurse, therapist, substance use counselor, housing specialist, peer support, case management, all wrapped into one team that provides services in a community-based setting. With being on that team, I was able to help the other team members understand some different aspects about the addiction process. Like if a client was still struggling in active use, helping them try to understand the thought processes that come with that, or the emotions, or the family conflict that they may have been experiencing. Again, bridging the gap, and I think that it's important for us as peer supports and family supports to be able to come into a room with other professionals with confidence and help them understand what our role is, so that the next time they're having trouble, or not being able to break through with a client, they usually call us like, hey, do you think you can go out and see this person and see like what's going on with them? I need to come out there and give them their injection, but they're having a moment, and so we help to kind of calm the scene and give some reassurance, not only to our team but to the client as well, like, hey, we're all here to support you, I'm going to be here with you, everything's going to work out, like we're going to get through it together.
Yeah, and I'll add from my lens, one of the things I have seen is exactly what Shantiza and Nikki have described is it's sort of when the other members on that team hit that roadblock and they're like, oh, we can't get in touch with the individual, or we can't, they're not engaging, or we're not able to, whatever. The first phone call that they're making is to that peer support or that family support. They're like, we figured out you're doing something we can't do in our role. Help us, right? So I
Mm.
think even some of the other members on those larger teams that may have, to use Nikki's words, oh, they're just the as soon as they hit those some of those roadblocks, they're realizing the power that these individuals hold and the greatness that they can do, and they're tapping into that. And then all of a sudden, there is no role and title that is better. Like they have that experience that just switches that light over for them and be like, oh, this is what you can do because you can do the things I can't do. And that's
Mhm.
pretty cool to watch.
Yeah, absolutely. So, I would imagine that a big part of being a peer support or family support specialist is having to kind of go into your own story and how you got into this and how you can relate to the clients that you're working with. So, how do you determine how much of your story to share, when to share it, if to share it? How do you kind of make some of those decisions about your own disclosures?
So
Well,
I'll just say that over the years I have gotten better at self-disclosure, and what I always try to make sure is I'm checking my motive. Like, why am I sharing this part of myself with this person? What am I hoping that they will get out of it? Because
Hmm.
if I'm just sharing to be sharing, then that's I'm adding my troubles onto the client, right? And I'm there for them. And so if I am like, let's just for example, working with a person that's experiencing housing insecurities. Hey, I remember what it was like whenever I had to live in a tent, and it was really hard. And I didn't really have the support to find the resources, but I'm going to be your support in getting you connected so that this is not a long-term thing, right? And I think that what that does is that helps them to see or to understand, well, wow, they do know because like they've done this before, so they know how hard it is, and they're more apt to engage in the service, right? So like I have some buy-in from the client that I can actually put them in my car and take them and get them connected to whatever resource that they might be needing. So yeah, motive absolutely must be at the forefront of my mind of why I'm sharing this, and then what am I hoping that.
Yeah.
same here. I think that if when I do share, I share for one just as an engagement, part of the engagement process. Hey, part of my spills, I'm your family support partner. The reason why I'm here, and this is what I do, and part of my role is this, and the reason why I'm here is because I've been through some similarities. Not probably quite as much as you, but hey, I'm sharing a little bit of my story, and also the boundaries. So not sharing too much, right? Because I've had it where I probably might have shared too much, and the family's so worried about me. They're more worried about me than they are them. Well, how's your son doing? And I'm like, maybe I should. So I learned that not too much, but just enough, if that
Hmm.
makes sense. Yeah.
Yeah. Yeah. So, how do we like we've gone over how important this role is and how, necessary it is for people to be able to talk to somebody who's been there, who's walked in their shoes. So, how do we continue to bring peer support, family support, et cetera, into more spaces in the behavioral health world so that more people can take advantage of these services?
I don't think that will be a us question because we we that would probably be a broader umbrella for us. But if every it would be they would be so helpful for every entity to implicate some sort of peer family support because we're dealing with people, we're dealing with human beings. There's a computer like all the time. There's computers are taking over the world, but computers cannot take over this type of position, right? You
Hmm.
cannot have a computer go in and be a family peer support person for another person, right? People are going to be people, and this is the position where like, and we're in hard times right now where people, we need each other, and it's just that important. So, like I said, I don't think we're not the ones that ask. We're the ones that advocate for more help. I'm here in Mecklenburg County, and I see the lack thereof that that's here. I'm like, man, that agency could use a family support partner, and I wish that agency had one too, because then that way, it would. We need more. There's definitely a need here in this county. I see. Yeah.
So I'll just say that there is space for almost every facet within the community and for peer support. Hospitals, primary care doctors, jails, law enforcement, DSS. I mean, the list just goes on and on and on, right? Any service work where we have contact with other people, we could create a space for peer support. Especially, I'll just use law enforcement as an example. They're trained in a particular way, right? They have like very specific trainings and very specific guidelines, and they have a dangerous job and they get called out to, let's say, someone who is actively experiencing psychotic symptoms. Well, if you have a peer support that has experience in working in that field, they can help with the de escalation process and maybe prevent something, going array and be able to talk to that person and offer them support and then communicate back to their agency, hey, we might need to do an intake for this person so that we can continue providing resources for them. I mean, there's just so many different areas that we could plug peer support in. And not only is it going to help the community, but it's going to help the organizations that they're a part of as well.
Yeah, and I think part of it is having venues like this where we can talk about the role and the importance and the impact of peer support. Certainly from that legislative perspective, we need service definitions and billing codes and rates that help support all of these things. But I think Shantiza hit it. Like there's so many of the entities that all of our North Carolinians and countrywide interact with on a daily basis, where we've seen these pilot programs where emergency rooms have embedded a peer support, or there's a peer support that goes on EMT calls, or there's a peer support attached to social services and the impact that that makes. And, one of the things I love about a pilot is it allows providers and that entity to be creative and try something new. One of the things I don't like is I'm like, oh, only the people of this one little pocket of population are getting to experience the impact of this. Um, so I think it's about getting the word out of the impact that peer support can have, and then also looking at that sustainability from that funding perspective. How do we embed peer support into those critical systems within our society that is sustainable, that allows for our peer supports to have a livable wage, allows that provider to pay them, to give them benefits and give that support and that services to those individuals. I can't think of a system that we all interact with that couldn't have the benefit from having peer support embedded. And as we look at sort of the things that are happening in our state or nationally, we know that there's a lot of emphasis on peer support right now because there's a lot of really amazing things happening in the peer support space. But also there's some things that, we probably wish we could do a little bit better and a little bit different. And so it's finding the good and those best practices and holding one another to those highest standards of care and empathy and support. And doing all of that. I'm going to steal Shantiza's word again, with intention. Having that intention to bring the good and the hope that recovery is not just possible, it can happen for all of us.
Yeah. Something that Nikki said really kind of struck me is that, if Mecklenburg County, the largest county in the state, is struggling to fill this need, how much more are some of our real mental health deserts, our rural counties
Absolutely.
throughout the state struggling without these same resources when surely there are people that could potentially, you know, come in and fit into these roles with a little bit of training. So,
Absolutely. And I think that even goes further, right? Like we have those mental health deserts, like you referenced, and we have some counties that don't have a child psychiatrist in them.
mhm.
But I feel very confident we could have the best family support partners working in those counties and getting that, getting what they need so that maybe there's just telehealth support at that moment for, for that doc. And so I think it is really looking at how are we able to do more with less, because I think that's where, some of the things that we have in our system that are realities now.
Well, a big part of NAMI's education about mental health in general is the importance of self-care and the importance of making your mental health maintenance routine and a crucial part of your day. So I would imagine that being in a peer support or a family support role means you're taking on a lot of other people's burdens on yourself while also trying to do that mental health maintenance for yourself. Can you guys expand a little bit on maybe how you set your own boundaries and set your own self-care routines while you're also trying to help others?
I'm still working on that.
Aren't we
But
all?
like I said, the position is rewarding, right? And so,
Hmm.
you know, I might have a great day, and then I'm going into a home where they're not having such a great day. So, just as a human, just being human, I kind of can find myself sometimes, falling into that with them and wanting to see the best results, and like going absolutely uh, as far as I can go to help this family during this time of crisis. So, of course, once my day is done, I'll come home sometimes and just have to debrief.
Hmm.
That was a lot, but learning to say, what, I have to understand this is not my situation, and I have a great team. We have like a thing where we kind of call it Vegas, and we just get in our chat and we'll just like let it out, and my team will support me. I think it's so very, very important. And yeah, that's kind of what I do. But I've learned that there you have to separate the two, because bringing it home, you can't bring home. So what I'll do is I'll bring it to the door and I'll check it out the door, and then when I come in, I'm able to do dinner, do the kids, blah blah blah. They're like, Mom, like what type of they don't really understand, because I'm not. I've learned to not come home, and so I used to do it. Come home and, oh my goodness, I used to do that, and then I had to learn how to check it out the door, same way. So it's boundaries.
Yeah, and just to piggyback off of what Nikki said, man, when I first started this career, I was going to save the world. That was my goal. Every person, I was going to save them. And I quickly learned that that is not reality. And I had to learn how to compartmentalize. I'm not there to fix anyone, right? I'm just there to support them and help them get connected to as many resources as they could possibly need so that they can learn how to problem solve independently. That happens quicker for some than it does for others, which is fine. But I also have to maintain my own recovery, which means for me, I have to attend a 12-step meeting. I have to contact my sponsor. I have to eat healthy. I have to make sure I'm getting enough sleep. I have to make sure that I'm spending time with people that I love and that love me, my family, whether it's my husband, my children, my grandchildren, my friends, just being able to like cut it off so that I can refill. Because when I'm out in the community, I'm pouring everything I have into my work and my clients because I want them to be well. And in order for me to do that, I have to make sure that I'm getting filled up. And that means like sometimes the phone gets turned off, and that's okay. I don't have to answer every phone call that comes through. I don't have to respond to every problem that is, coming up, whether it's a client or a family even or a friend. Because I've been in that space, and that's not healthy for me. And in order for me to continue doing what I absolutely love to do, I have to make sure that I stay healthy. mentally, emotionally, spiritually, physically, all the ways.
Yeah, absolutely. I mean, that's important for all of us, I think, no matter what career we have, but especially for those trying to be in these helper roles, in these, um, well, yeah, helper roles, provider roles, um, and trying to, help carry the burdens of others who are going through these similar situations. So, kudos to all of you for the work that you do. Really is appreciated. Really is, a vital part of this entire recovery process. And something I know I didn't have going through this, and a lot of us didn't have. So the more we can provide it to others, the better. So um, I wanted to see if you all had any other closing remarks you wanted to make before I turn it over to any potential questions from our viewers today. Did you guys have anything else that you wanted to mention about your role, your work, your experiences?
I know we're always looking for a few good men, so please join us.
Hmm.
Yeah, and we just really appreciate the opportunity to be here and hopefully the passion that we all have, not just for the general behavioral health services, but just for peer support, has shown through for everybody. And if you're considering that career in peer support, hopefully we nudged you in that direction today, or encourage if you are in an agency to bring peer support into your agency.
Yeah. Well, speaking of agencies, I did get one question that is asking whether SPARK is an acronym. And if it is, what does it
It
stand for?
it is. So it stands for Supporting People's Access to Reliable Care.
Hmm. Excellent.
Little,
Okay.
it's a big title, so Spark is a lot easier to say, but yes, that's what it means.
Right. Okay. Yeah. And so I am going to put Spark's website in the chat just in case anybody is curious about your agency and wants to learn more. And I also want to take this opportunity to plug NAMI's Peer Leadership Council. Our Peer Leadership Council is a group of peers, people with lived experience in recovery who want to have a say in the initiatives and the priorities of NAMI North Carolina's leadership. And so they meet up and they discuss issues that are particularly relevant to peers and how NAMI can best support them. And they are always looking for additional members. So I'm putting that information in the chat as well. You can learn more about them and how to get involved in that peer leadership council. And also, of course, we're still taking questions if anybody has them, but I will also plug our helpline, which is a way that we help to provide additional resources for people. Some of those resources being certified peer and family support specialists nearest you. So if you have any questions or want to talk to somebody after this, you are more than welcome to contact our helpline for more information. Um, I'm just checking to make sure that we have answered all of the questions. It looks like we have. So I want to take this opportunity to thank our panel so much for your time and attention. The work you do is, I'm sure, incredibly hard, but like Nikki said, incredibly rewarding. And we appreciate the focus too on intentionality and making sure that that the work you're doing is not just you're providing support that has a structure, that has a foundation, and that is going in a positive direction. And that is always a blessing to be able to highlight. So thank you all so much for coming and talking about your experiences. We will be providing any contact information that we can share, a recording and a feedback survey after this to everybody who registered. And this video will be up on YouTube probably by Wednesday, the 18th. So keep an eye out for that. Also, we encourage everybody on the call to keep an eye out for our next NAMI at Noon session, which is going to be next Tuesday, the 24th, where we'll be talking to Yannick Hicks about how resilience training can help people in the healthcare field, including mental health care, learn leadership skills that they can then disperse to their own teams and improve their leadership as well. So we appreciate everybody coming. Thank you so much. And until next time, we hope everybody has a wonderful afternoon and happy St. Patrick's Day.
Yes, thank you for having
Bye,
us.
everyone. Thank
All
you.
right, bye.
Thank you.
Bye.